I wanted to be more involved in the hospital, and I was here as a volunteer, and you experience a lot of hospital life. I'm also a patient here, and then I just found I had a lot of ideas, a lot of views, and I thought it was a more constructive way. You know, if you've got views, it's great to have an outlet for them.
The purpose of the Community Advisory Committee is to provide the perspectives of consumers, both health consumers, carers, significant others in the work of the hospital and the services we provide.
Well, I think the CAC is about finding new ways of communicating and better ways of communicating between management and the community.
I think it's also to provide a diversity that reflects something of the Alfred Health catchment. So we have people on the committee, people with a disability, people with chronic illnesses, people who care for people who are regular patients at the hospital. Across the board, I think we're a very good resource for the staff at the Alfred.
And I enjoy having the management actually at the meetings and knowing, from the CEO to other heads of department, knowing that they're actually listening to what we say.
The perspectives that we get both from the Consumer Advisory Committee, but also we have a consumer register of 90 people, and we regularly survey the catchment, and we try and make sure that informs the staff in their work. You know,
the other day I was walking through one of the corridors and I noticed something had changed by way of signage that I'd spoken to the hospital about, and I mean that was a wonderful thing to see.
The thing I'm most proud of has been the fact that I think the principle of community participation has been widely adopted by the hospital, that it's come from the executive and the board down, that the concept of involving consumers in their care and making sure that everyone understands what that means in the hospital has been embraced. And I think the Community Advisory Committee's had a major role in getting that happen and making sure that the energy is there within the hospital to make sure there are successful outcomes for patients.